Hello there. Welcome to this episode of NAFDAC and Your Health. On this program, we provide you with insightful information about NAFDAC's activities aimed at safeguarding the health of the nation. My name is Okpejemi Orimolade. Our main focus on today's episode of NAFDAC and Your Health is the meeting between NAFDAC and stakeholders on mitigating substandard and fake products using the Clean Reports of Inspection Analysis Scheme, CRIA. The obligation of NAFDAC to safeguard the health of the Nigerian people by ensuring that only quality, safe, and efficacious drugs, food, and other regulated products are made available to the Nigerian people is a very tasking one, going by the activities of unscrupulous people who engage in the counterfeiting and production of substandard NAFDAC-regulated products. Apart from those that engage in these illicit acts locally, a high degree of the substandard and counterfeit products is also imported into the country. NAFDAC has, however, continually adopted various relevant policies and strategies in mitigating substandard and counterfeited products by importation through her Directorate of Port Inspection in ensuring that the health of the Nigerian populace is not compromised through the unscrutinized regulated products that are imported.
The objective of the meeting, of course, is to introduce you to the NAFDAC-approved CRI agents and their role in ensuring that only safe and high-quality products are exported into Nigeria. Globally, the manufacture and trade of substandard and falsified medicines have become a lucrative crime, particularly in low and middle-income countries. This has resulted in economic sabotage, treatment failures, drug resistance, loss of lives with that, terrorism, and national insecurity.
The NAFDAC Director General also spoke about factors that led to the availability of substandard and counterfeit products and the impacts of the products on the society.
Of substandard falsified medicines and counterfeits is fueled by challenges in vigilance challenges we have experienced in vigilance and regulatory activities, corruption, insufficient technology, political will, and patronage by healthcare providers in Nigeria. NAFDAC has made significant progress in addressing the prevalence of substandard falsified medicines. The presence of substandard falsified medicines poses several challenges, including decreased confidence in healthcare systems due to the targeting of high-demand drugs in public health, therapeutic failure, I've mentioned that, adverse drug reactions, and increased drug resistance. Loss of lives, involvement of organized criminal networks, which see counterfeit medicine trade as less risky than narcotics trafficking, reduce access to safe, high-quality, and efficient medicines. Use of advanced printing technologies to invalidate the details that the original manufacturers put on the packaging, meaning labeling that the original manufacturers put there in terms of expiration is changed using these advanced printing technologies. Of course, significant financial losses to the legitimate manufacturers in case of counterfeits, and of course, accompanied loss of lives for substandard falsified medicines.
Professor Mojisola Adeyeye went on to talk about the significance of the CRIA scheme and the review of the scheme on her assumption of office to strengthen it and enhance its efficacy.
The CRIA is one of NAFDAC's anti-counterfeiting strategies aimed at preventing the importation of such products and other regulated products into Nigeria. Upon assuming office as NAFDAC Director General, I reviewed the scheme and the performance of existing CRI agents. This led to the suspension and eventual disengagement of one CRI agent in India, and then the renewal of contracts. Not only signed agreement with CRI agents, we also signed agreement with the laboratories. And we went physically in 2019 with my staff to India and China. So it is not just that we saw what they wrote on the paper, it is that we visited each lab to make sure that what they said they can do is actually what they would do. These measures were implemented to strengthen the scheme, enhance efficiency, and bolster the fight against counterfeit and substandard products. Over time, significant regulatory strengthening has been undertaken. We have a multi-strategic approaches to mitigating substandard falsified medicine. CRIA scheme is just one of them. For the CRIA, I mentioned we had agreements signed, issuing service level agreements, establishing guidelines for service provision to NAFDAC and clients, and intercepting, of course, substandard falsified products through our own investigation and enforcement. It is important to note that all NAFDAC regulated products require CRIA processing, except those on the CRIA exemption list. I encourage you to visit the NAFDAC website to review regulations and guidelines on product registration, permit issuance, labeling, and shipment into Nigeria. CRIA agents operate under clearly defined guidelines to ensure efficient service delivery and support NAFDAC in its mission to combat the importation of substandard and counterfeited products. I strongly encourage you to engage the CRI agents before shipping any consignments, that is to our stakeholders now, from China or India to Nigeria. You have the flexibility to choose from any of the listed CRI agents to ensure compliance and safeguard the quality of imported products.
According to the NAFDAC DG, the introduction of the Port Inspection Data Capture and Risk Management System, PIDCAMS, an electronic platform, was also one of the initiatives to boost the CRIA scheme.
Additionally, NAFDAC has introduced an electronic platform, the Port Inspection Data Capture and Risk Management System, we call it PIDCAMS, for verifying documents issued by NAFDAC and CRI agents and for processing inspection reports. The scheme is currently operational in China and India, from where we get about now 60% of our import. It used to be 70% of import. We have decreased our importation because we are laying more emphasis on local manufacturing. So because of the fact that most of these drugs come from China and India, the scheme is operational in those two countries. It has significantly strengthened our regulatory control over products exported from these countries to Nigeria. It ensures that only safe and high-quality products are shipped while preventing the export of substandard drugs, counterfeited products, and non-compliant products. To date, the CRI scheme had successfully stopped nearly 200 consignments of products that failed laboratory testing at the country of origin and prevent shipments that did not meet NAFDAC's documentation and labeling requirements. These 200 consignments that we are talking about is not 200 containers. One consignment can be 50 containers within the 5-year validity period. So when we talk of 200, it means 200 products that have been approved by NAFDAC before, and upon getting into the country, the CRIA scheme stopped those 200 consignments of products from coming into the country.
Professor Adeyeye added that NAFDAC appointed agents in China and India, two countries where products are majorly imported to Nigeria, should ensure the effectiveness of the pre-shipment scheme. She also enumerated the responsibilities of the agents.
To ensure the effectiveness of pre-shipment scheme, NAFDAC has appointed these agents in China and India as follows. In China, we have the China Standards Tech Services, CSTS. We met all these people face to face in 2019. China Standards Tech Services Limited, Guangzhou Test Technology Consulting Company Limited, NHU Laboratories, Shanghai Hanlin Laboratory Limited. In India, we have Assurance Analytics, Cotecna Now, that is joining Inspection Services, QCS Labs, Control Labs. What are the responsibilities of the CRI agents? Visual inspection, verify that product labels comply with NAFDAC labeling guidelines before shipment. Ensure packaging is adequate, secure, and compliant with NAFDAC standards. 2. Product-specific testing. To conduct random sampling and send samples to NAFDAC-approved laboratories for quality evaluation and confirm that those products meet safety and quality requirements. 3rd, compliance with regulatory requirements. They review regulatory documents provided by exporters to ensure authenticity. Verify shipment documents such as invoices and packing lists for accuracy and completeness. Report cases of failed laboratory analysis and forged documents to NAFDAC. We have had experience with forged documents. They also identify and report shipments that may have passed CRIA processing without them knowing. As stipulated in the consultancy agreement signed with each CRI agent, there are designated laboratories in both China and India where sample products must be tested. Like I mentioned, we physically went to each lab to inspect them. The reports issued by CRI agents encompass critical aspects such as quality, quantity, packaging, labeling, and compliance with NAFDAC regulations, documentation standards, internationally recognized pharmacopoeia specifications. Beyond ensuring compliance, the CRIA scheme also facilitates international trade by providing Nigerian importers with confidence that their goods have been thoroughly inspected and they meet regulatory requirements.
We'll take a short break now. Please stay tuned.
Substandard, falsified, and counterfeit medicine is a threat to maternal and child health. NAFDAC, in its commitment to prevent maternal death and drastically reduce child morbidity, advises healthcare providers to ensure that quality, safe, and efficacious medicines registered by NAFDAC and properly stored are used. NAFDAC requires that registered medicines must have NAFDAC registration number, batch number, manufacturer's name and actual location address, manufacturing date, expiry date, and scratch and test for anti-malaria and antibiotic medicines. NAFDAC advises the general public to purchase medicines from registered pharmaceutical retail outlets as prescribed by the healthcare providers. NAFDAC, safeguarding the health of the nation.
Welcome back. If you're just tuning in, you're watching NAFDAC in your health. Speaking earlier, the director in charge of the Port Inspection Directorate of NAFDAC, Dr. Olakunle Olaniran, explained that CRIA is one of NAFDAC's most effective strategies on importation.
One of NAFDAC's most effective strategies over the years has been the implementation of rigorous pre-shipment and inspection and analysis protocols and the issuance of the report of inspection and analysis at the country of export. This proactive approach accepts us to identify and intercept counterfeit and substandard products, regulated products, before they enter the supply chain. Shipment inspection is not just a regulatory requirement. It is a critical component of our comprehensive quality assurance strategy. It involves thorough examination, testing, verification to ensure that they meet the necessary safety, quality, and efficacy standards. I'm glad to notify you that Port Inspection Directorate of NAFDAC has gained tremendously from the deployment of CRIA scheme, especially in the over 200 regulated products that have been either stopped from coming into the country or intercepted on arrival following intel from the countries of origin. Cases ranging from outright falsified products or documents, alteration of labels, or attempts to ship products that have failed laboratory tests have been intercepted. We have also had few cases that deliberately attempted to evade screening of CRIA for no reasons, unacceptable reasons. These have always been apprehended, and we have always sanctioned them appropriately.
Dr. Olaniran also commended the NAFDAC DG for her efforts in keeping CRIA effective and relevant over the years.
Over the years, this CRIA scheme has undergone a series of modulations and optimizations to keep it effective, relevant, and result-oriented. Our dynamic and very digital Director General has, from the inception of our administration, placed emphasis on keeping the scheme fit for the intended purpose. Some non-performing agents were dropped from the scheme, while new additions were made.
There were virtual presentations from stakeholders from India and China, while relevant stakeholders like the Association of Licensed Customs Agents and the Association of Food, Beverages and Tobacco Employees were also in attendance.
And now, moving on to NAFDAC news updates. The Rivers State Office of NAFDAC has raided shops at Woji, Mile 3 and Mile 1 markets in Port Harcourt where fake and repackaged rice were being sold. One of the shops in YKC axis in Woji, Port Harcourt, suspected to be where the fake bags of rice were being sold, had empty fake big bull bags of rice and other products including cap rice, stallion rice, tomatoes, Mama Pride and so on. A sales girl was also arrested at the shop. A kingpin in the illicit business, Ibelatu Masi of number 4 Estate Junction, Woji, and the owner of the Woji shop where bags of rice and repackaging materials were recovered, was eventually arrested and brought to the NAFDAC zonal office in GRA, Port Harcourt. He admitted that he was repackaging bags of rice, claiming that it was damaged rice from trailer loads of rice that had accident and those that water might have touched that he cleaned and repackaged with branded bags. He also claimed that he used to get bags in large quantities from house scavengers. He was later taken to the NAFDAC Enforcement and Investigation Office at Sabah for further investigations. More than 120 fake bags of rice from more than 10 shops were evacuated to the NAFDAC zonal office. Other items recovered in the shop included sewing and sewing machines, generator set, stove, thread and bags of already repackaged rice. The coordinator of the Rivers State Office of NAFDAC, Pharmacist Onogu, said that the bags of repackaged rice are from questionable sources and can lead to health challenges. He therefore warned the general public and traders to beware of the fake and repackaged rice being sold to the public. That was NAFDAC Update. You have been updated.
That's all time permits us to take on this episode of the program. Please make it a date with us, same time, same station, next week for another insightful episode. If you have comments, complaints, or you have reports about peddlers of fake drugs and adulterated food products, we're always available to listen to you.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
It is important for you to know that importing, producing, advertising, distributing, and selling of food products, drugs, cosmetics, as well as adulterated chemicals and unapproved water are all criminal acts and can destroy human lives. Join the fight against these heinous crimes by reporting any suspicious activity in this direction in your area to NAFDAC. Let's join hands to safeguard the health of Nigerians. See you again next week. Stay safe.